Hey, everybody, welcome back. This is Matt Brown, your normal host here at Dental Unfiltered. And I have an awesome guest. I've been trying to get on the show for almost 2 years. We met at AACA almost 3 years ago, instantly hit it off. We have a lot of parallels. He's a veteran, I'm a veteran. We both strive for excellence and achieving amazing things. He's from the Northeast, I'm from New Jersey. He practices in New Jersey, and we instantly hit it off. We both have New Jersey attitudes. We're both kind of driven to complete extreme missions, and his extreme mission, as opposed to what mine used to be in my old profession, is he is the number one Invisalign provider in the country. And I've heard people say things every few minutes or every 10 minutes or every 30 minutes. Trays are going out of his practice. That it's just a machine that churns out amazing Invisalign cases. I was at the AACA this year. If you're not a member, it's a great organization. They had their awards and the diamond makers came on, and he basically graduated his class, and there were a bunch of dentists who got awards for first time goes or first time passes of like perfect cases. I know docs, that's where a lot of docs struggle with this. And I think there's two amazing resources as brains in Invisalign. And of course it's David Galler and Michael Wollock, who's our guest today. And I cannot tell you how excited I'm about this. So, Mike, you developed Diamond Makers, which is the premier process to become a diamond provider. I think the diamond or higher level is the holy grail of clear aligners and Invisalign. It brings your lab fee down, makes you more productive, and also means you're really good at it. Because if you're doing that many cases, you're good. So, when did you realize you could do this? Like, when did you realize, like, I'm an extreme scenario for Invisalign and I could spread this knowledge? When did you realize it? What was your motivation?
Yeah. So, one, I'm humbled by your intro, so thank you. It's very nice. Really, I think the journey has been since 2001 when Align released general dentists to do Invisalign. I saw it as a great opportunity. I didn't know how to do ortho. They don't teach you that in dental school. And so I said, wow, ever I refer out very little, maybe 5% of endo, 5% of kids, 5% of extractions. And I keep 95%, but all my ortho was going out the door. And as a business, I said, wow, there's an opportunity to be had. Here's this great new product that all I have to do is take impressions, because at that point it was impressions, and I could just send them away and just hand out these trays. And what I found out quickly is it does not work that way. And I started on a journey of CE, of trying to learn it because I still thought it was great, great idea. Let's execute it. Let's overcome. And you and I have talked about overcoming barriers, perseverance, and let's overcome the barrier. And so I searched and searched, and there were only orthodontists teaching Invisalign. And orthodontists don't want to talk to general dentists. And when they do, they talk in a different language and they talk down to us. They're like fighter pilots, and they're going to tell you that in every way, and they are not going to let you fly their plane. And so then I found David, and I don't know, 12, 15 years ago. It was his first time lecturing out of New York City. He was down in Philly, and I'm actually practicing just west of Philly, outside New Jersey. I escaped our state, Matt.
Yeah, good state to escape.
Yeah, I escaped it. But I found David and I was like, boom, wow, this is great. And I'm texting him from the back of the class because he gives out his cell phone number and he's sitting up there lecturing and his phone keeps ringing and it keeps humming because I'm texting him. I'm like, dude, you got it. You got it. Anytime you're in town, this is great. And he connected because he's one, a great speaker, he's a great
Oh,
entertainer.
he's a great human.
Yeah.
Great
And
human.
he has material at that point and now that just no one was doing. And it was from a general dentistry perspective. So, I took his class, re-engage, and that again, I don't know, 8, 9, 10 years ago. And my numbers were probably 40 a year, 40 a half. And most dentists, even today, only do about 15 a half. And they went to 80, and the half after they went to 120, and then 120, and then 240, and then now I do 350 plus a half, which basically gives me the coveted blue diamond, blah, 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 which is really nice. And as you said, people strive to be this diamond. And in the beginning, that's ego. I had a patient in the other day. He's like, whoa, what are those Super Bowl rings? Because David gives out these rings for accomplishments. And I'm like Bill Belichick. without the 15-year-old girlfriend.
You and Jason Sallow were in the rings at the event, and the first time I saw I didn't know about it. I saw Jason Sallow all these rings on, and I'm like, "What's Jason wearing?" I looked at his hand, 'cause me and Jason get along pretty well, and I was like, "I want a ring."
Yeah. Jason's a DCMer, and that's the organization I run. And so, yeah, and it's like, wow, it's a great accomplishment, great ego thing. But in the end, it really boosts my numbers because being what I do with dentistry, so I'm a single dentist, single office, most common type of dentist out there, GP dentist out there. And I've done something that no one else was capable of doing at the time. And now I'm able to have people reproduce it, which is to incorporate this much Invisalign within their practice to expand their business. And I use it as you'll like this term, a force multiplier.
I say that all the time in dentistry, yeah.
Why not? If you can do something that multiplies things rather than adds, it makes you so much more productive. And most dentists look at practice growth. Oh, I need more hygiene patients. Okay, so let me understand. You want to spend time, effort getting in a patient who most likely is going to balk at you if you charge them one penny over their insurance, who, when you meet them, will look at you and say in code, yeah, I'm just here for a cleaning, which means don't find anything. I know I'm losing four teeth out of my mouth. If I breathe too hard, they're falling out. But don't say anything about it because I won't like you. I will leave you a 1-star review. I'll burn you at the stake. I'll follow you home and berate you at your house if I could. And so that's not the patient I want. The patient I want, and don't get me wrong, I want to grow my hygiene practice, but I would rather have a patient come up and say, Doc, I want to pay you money out of my back pocket to fix my smile. Hold on. And you're willing to pay me thousands of dollars right up front to fix your smile. That's a dream for a dentist. And then, you know what? I know you have your own dentist. Awesome. Great. Stay with them. I'm going to fix your smile with Invisalign. And then just go back. You're good. Or there's the other half of the people who don't have a dentist who are like, yeah, I didn't like my last dentist. And I don't, they tell you this sob story, which is going to be you. You're the next sob story they're going to tell. But they're like, and I'm like, great. My team is like, hey, you want a cleaning too? They're like, oh, yeah, that's great. Now you have a force multiplier. They're building your and look, you could benefit from a crown back there. Oh, yeah, doc, I trust you because you just fixed my smile. And now you're the best dentist I've ever had. And I'm going to tell everyone in the world. And they leave reviews, they leave video testimonies, they go on their Facebook page and say to their group that, oh, this is the greatest dentist ever. I had a flight attendant in yesterday. They actually travel from far and wide. I get flight attendants. I've gotten dentists I've taught who are on planes with flight attendants wearing Invisalign, who their Invisalign is from me. And I
Well,
get
your
this
volume is
selfie
so high, the probability's high.
because I get into these groups with that. And so that's the other thing I'm pulling. And the other force multiplier is hygiene pulls from most suburban dentists 2 to 3 miles away. So 85 to 90% of all GPs, their practice revolves around 2 to 3 miles away of their patients. Which is very confining depending on where you are. I pull from the entire Philly metro area. And I pull even beyond that. I pull from Wilmington, Delaware, Lansdowne, all the way to the Jersey Shore. I get people driving in from Ventnor. And I pull from New York City. I have a little cadre of people in New York City who come down and they just word of mouth. And it grows and grows and grows. And they come in and they tell other people and they build my regular GP practice. Because ultimately, why I got into this long story, Matt, sorry, is because I do this not to get diamond anymore, which is nice. It's great. I do this because it builds my practice. It builds my financial wealth, my financial freedom for me, for my team, for my family. And I get to make choices that I wouldn't have made otherwise. Like, look, dude, you're an asshole. I don't want you as a patient anymore. You know what? I think you'd be better off going to see my competition. And so I've put myself in that position. I've earned it. Not because I'm that great of a dentist, but because I have financial freedom now. I think I'm a good dentist, but I don't think I'm the greatest dentist. I think I'm one of the better Invisalign providers out there, not because I'm smarter, not because I've got great hands, but because of the way I look at it and the experience I've had. That's, I don't know where we started with that, and I
Yeah.
rambled for a
No, no,
while.
no,
So,
it's good, it's good. So,
yeah,
for the listeners that don't, know the area he's talking about, Delaware to New York to the Jersey Shore, these areas to pilgrimage to where Mike is on the west side of Philadelphia. Philadelphia's a massive metro, you gotta move all the way across the entire city, it's the furthest point from those locations, and that pilgrimage could be an hour from some of those locations,
the 2 hours.
and then sometimes during the day, coming from New York to there could be 3 hours. Like, I lived there and commuted there. So, docs get into Invisalign. I've watched this happen, right? And they think I just buy the Atero, I get set up, and I'm just gonna start doing Invisalign. And then I think they know the profit center is there. I think it's like mining for gold. They have all this material to work with that all these patients. This is the deal. And I'm not a dentist, right? But I spend a lot of time with you guys. I believe 95% of patients need ortho
Yeah,
on some level, right? Whether they want to pay for it or not, right? So I believe in a culture of scan everything, scan everybody, once a year, whatever it is your frequency, right? And show them the simulator and plant the idea of ortho because everyone is very vain today. Not vain, but your appearance matters, right? So you identified the profit center and saw it, but you noticed that you weren't getting it out of it. You knew you couldn't mine out of it properly. You had all this material, you couldn't put it through the process. So you seeked improvement. You learned from it. Now you brought it back to the community in diamond makers, right? So if you could give like 3 tips, and then I want to get into diamond makers and more about that. 3 tips. So docs are listening right now, and they're like, "Man, I'm having like Michael is saying my problem." If there were just 3 tips that were executable in the practice tomorrow, that would get them going at least a better direction than they are right now. So if they're doing 10 cases every 6 months, what would get them just fundamentally to 30 or 40, not looking at outside sources for revenue, looking at inside sources?
yeah. So I'm going to answer your three tips, but I'm going to blow your mind a little bit. The least preferential patient I want to treat for Invisalign is my hygiene patients. Okay. Um, I don't, I want to treat them for crowns. I'm a general dentist. Crowns are a great profit center. Crowns can help people. Fillings, I'm good at it. I can boom, boom, boom. I want to treat them with Invisalign from a business standpoint. Okay. When they are fully restored, I want to treat everyone else's patients for Invisalign and have them come to me. And when their dentist retires, when their dentist pisses them off, when their dentist is push them off in the schedule, when they didn't have a good visit, they then think, oh, I love that guy who treated me for Invisalign. And by the way, I make plenty of profit just treating someone for Invisalign. But again, force multiplier, I want to treat all of my other dentist patients. It's a way in my practice. And oh, Dr. Wollock's always on time. He's so nice. He's there at 7 a.m. in the morning, 2 days a week, 8 p.m., 2 days a week. Wow, my dentist doesn't do that. My dentist is like
You
banker
you
hours.
do you do 8 PM 2 days a week? At
Yeah,
this point
yeah,
in your
yeah,
career, that's
yeah.
unheard of.
Yeah. So that's a Chris ad marketing little tip for you. The one of the oldest dental marketing companies. I love what you guys do, but they run pamphlets.
There's so many
They
great
run
marketers out
pamphlets.
there.
That's
Yeah.
their little thing. Okay. So John Christensen preaches these principles, and one of the principles to take down barriers is you got to be open early and after, before work and after work. So I took that away from him, and I've learned stuff along the way, things like that. But the 3 things that really make a difference. So scanning patients, I absolutely do because different reason. I'm not trying to get them into Invisalign. I'm trying to wow them. I get a new patient in. First thing I want to do is scan them. What? My dentist never did that. Oh, yeah, no, we've been using this for 10 years. This is great. Look at your teeth. Then they start moving the screen. They're involved. when you get people opening up and being involved, even if they don't need dentistry, even if they need it, but they don't want to buy it, you have now set yourself apart from anyone else they've ever seen.
Yeah, that culture of scan everyone isn't common. And my take on it, and you say you're a dentist, I'm not, is they see a part of their body they've never seen before with their own eyes.
And they see it in a way that they can interact, that they feel comfortable on a screen. We let them move it, we pull it right up to them. They need to, if they're not interacting. So listen, 9/11. I'm in a dental office. I watch buildings go down. Dramatic, horrible. I had a high school buddy in one of those buildings and just terrible.
I was in high school in Medford, New Jersey, and a lot of people commuted from there to the city. And I was in class, we turned it on, and I was in class with kids whose parents were in that building.
Yeah. And so, what have we all done at this point? We block out anything on a screen. I got to filter it. Anything on a screen. I mean, once you suffer trauma, I stop. I just, anything on a screen is not a part of me anymore. So there are a couple of things you can do to overcome that. Because when you're showing someone, every dentist is like, oh, I got screens on the ceiling, I got screens in front of them. They're not interacting. And human beings interact. And so when you can put a touch screen in front of them, there's a physical aspect. They're connecting, they're moving. When they do that, it's completely different experience for them.
Well, it's also the standard of human communication today is using a touch screen to text. People text 90% more than they talk, right? So it's a very familiar thing to touch something and move it and manipulate it. And it's very comfortable. It's very natural now.
So I have 8 ops, my one office, 26 hours a week. We do, and I'll share you my numbers. 5.1 million a year in collections. One dentist, no associate, 26 hours average a week. I'm treating starting over 350 Invisalign cases a half, 700 plus a year. Um, and not for the lab cost savings, but because, I mean, that's part of it, but really we're doing, I think it's 150, and this is what I teach in DCM. We're doing 150 average, $1,500 an hour in collections chair time from my Invisalign chair. Most dentists don't do that on bread and butter single unit crown, their most profitable item in terms of, and that's team time. Doctor time collections per hour usually ranges anywhere from 5,000 to 7,500 per hour with Invisalign. And that's what I teach in Invisalign. How to do a lot more Invisalign, but how to do it a lot more profitably, making patients much happier who then refer. Um, Most dentists think, oh, I got to straighten teeth. And yeah, that's part of it. But what you really need to do is you need to treat patients and not teeth. You need to make patients happy. You can have the straightest teeth in the world, but if that patient is not happy after the experience because you hurt them with it IPR, because your treatment dragged on for so long, because you just didn't manage the case correctly, which most dentists don't, you not only didn't make money at it, you might as well have paid the patient to get out of your practice, but you also pissed someone off and they don't tell other people. My Invisalign patients tell everyone.
Well,
So let me get
it's
back
like a
to
billboard on their face, their new smile. People see it,
they
they ask
do.
them. It's a billboard
They
on their
do.
face.
They do.
100%. Yeah.
And that's why I do this because it's a
Well,
force
what
multiplier.
you're saying is it's human first, not clinical first.
You're treating people,
Yeah, it's human.
not
That's
teeth.
yeah,
Dentists go like this. Ooh, teeth,
yeah,
teeth, 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 teeth. No, these things are attached to these things.
yes.
And when you forget that, you've lost your way. So I can teach a monkey to do what I do as a dentist. Okay. No disrespect to monkeys. But I think I could teach a monkey to do a class 2 filling. Um, I know I could teach my assistants. I got to tell you, my assistants are freaking awesome. Great respect, but they work hard for it. And I've taught them legally what they can do. And they're better at things than I am because they do it every day. So it's the action is important, what they're physically doing, but how do you relate to that patient as you're doing it? I mean, as a doctor, our patients are not asleep. I mean, all my buddies are cardiologists. They go in, they do this one or two procedures in cardiology surgery every day or GI stuff, and it's just repetition. And they're doing only 8 patients a day, 6 patients a day, same procedure in and out. All their patients are asleep. They don't have to talk to them. We've got to talk. I mean, I'm seeing 80 to 100 patients a day with my team, and I've got to talk to each one of them. I've got to make them feel special. I mean, that is really the art of what we do as dentists.
Number 2, what is your number 2 tip for
Number
growing?
two tip is go see David Galler. Go see David Galler in Reengage. David Galler in Reengage still, again, I think this course is
No,
now 8,
I think it's a
10,
course
12
that
years
people
old.
can take multiple times and get something out of it.
Oh yeah, well there's Reengage 1, there's Reengage 2. He's made me, I'm honored to be there, so I say that in jest, audit it several times for different reasons as part of his organization. In fact, I'm going to the December class in December, whenever that is, to meet and greet for DCM and hang out with David. Hopefully Andre will be there. And so yeah, take Reengage. Reengage will blow your mind. And if you haven't taken, and I've sat in the other great lectures out there, great respect to them, to get up in front of a stage and speak to people. I don't do that well. I do most of my stuff online, mentoring online, communicating online through WhatsApp. I don't like being on a stage, but those people who do, great respect. I can't do what they do, but David does it in a way that is just heads above.
Yeah, David can make anything entertaining. I just spoke at, the Calgary Study Club, like, last week. I was up there in Calgary, and they were doing one of the modules before me speaking and teaching my module, and it was David on screen, and I'm watching it, and I'm sitting next to Raul Code, who's one of your board members, and Raul's like, "This guy can make anything entertaining." I'm like, "No, dude, I'm watching it laughing, and he's talking about, like, clinical crap," and I'm like, "Only one person I know can take clinical crap and make you laugh, and it's
Yeah.
David Galler."
Oh, laugh
Yeah,
hysterical, like belly
yeah,
laugh,
yeah.
solid belly laugh. Oh yeah,
Yes, and just so everyone knows, if you wanna join the AACA, it's a great organization, and this is not an infomercial for AACA. This is an organization I believe in also. I think it's like
and I'm a
600.
board member for
Yeah, yeah.
life now.
Yeah,
Yeah,
it's $600 a year or something, and it's kinda
nothing.
if you're doing clear aligners, it's, like, stupid not to. So,
Oh yeah.
tip number 3 to do more Invisalign in the practice.
Well, I'm going to plug myself because I'm going to tell you why. DCM, Diamond Club Makers. Bottom line is, so I take that reengage, and I teach people who've never taken reengage. They excel as well. I mean, the ideal path is reengage DCM, but we've done it anyway. I get 1/3 of my DCM students come from outside ACA, and then I convince them after DCM to take reengage. So, but DCM is so what we've done, and I could speak to a lot of this, really the ultimate thing is 1/3 of all North American GP diamonds are DCMers. They were not
So,
beforehand. They are
1/3 of
so
all diamond
1/3 of
providers
all
across the
North American,
entire country are DCM graduates.
not just North
North America,
America.
so
I'm taking
Canada.
a continent. I'm not taking a country. I'm taking a
So
continent.
1/3 you're responsible. So you as an individual is responsible for 1/3 of all diamond or up
Yeah. Yeah. I'm
Invisalign
very
providers
proud of
in the
that.
country. And just
Yeah.
a side note, guys, if you're a listener, he rejected Dr. Vallo because he was multi-practice a couple years ago. Dr. Vallo, my co-host, had been you were like,
I
"No."
told him I'm sorry.
I know.
I've
Actually,
I've changed my parameters.
yeah.
Multi practices get in now.
Oh,
Okay, but he's moved on. He's moved
he's
on.
diamond. He's
Yeah,
diamond
yeah,
blue or
and he's
something.
jaded. I could teach him how to do it much more profitably,
He's
but
not
he
jaded.
doesn't want to listen to me now.
We joke around about he's not jaded. Because he knows I'm involved with you guys. So DCM's your third tip, which is a really, I mean, guys, these organizations, like he's responsible 1/3 of the people in North America that are diamond or higher.
Yeah,
That's
and
great knowledge.
most of them, while they're multi-practice, while there's some DSO people in there, most of them are just like me, single office, single dentist, which is the most common dentist there is. And they don't have the ability without DCM to become diamond. Like it's easy to become a diamond if you have 5 or 6 offices. It should be, grant you. Now, I've taken from one of the bigger lecturers, to go unnamed, one of their coaches who has 5 or 6 offices down in Texas, could not become a diamond and is one of their top coaches. came to me, said, "Look, I'm a coach. Can I still take?" I'm like, "Okay, I'll let you in. Just don't teach my stuff." Hopefully, he's not. And he's now a diamond ever since. But if you have multiple offices, it's easy. If you have multiple dentists, it's so much easier. If you're a single dentist, single office, if you do exactly what Invisalign tells you to do and you're perfect at it, there is no path for you to be diamond year after year after year after year. There is with DCM. I teach you how to do that. And you don't then want to be a diamond. You want to be more profitable. And that's where it keeps going.
We deal with, at my job, over at the Energize side, which I try not to mention the company because I want this to be an infomercial.
No, it's great company.
Yeah, we have 350 dentists, right? And we have a lot of Invisalign docs. And you talked earlier about case management, and we do consult reviews with our clients, and we ask them about modalities of treatment, where they're at with it, what's struggling, why don't we have all the collections yet, that kind of stuff. And I got a lot of docs like, man, I'm really far into this Invisalign case, and I'm bootstrapping this and trying that and putting on attachments, and I'm just not getting the movements I want. And case mismanagement, I think, is after you're finding a way to get these cases. I think the next layer is case mismanagement, which you alluded to earlier. And when you were on stage at the last event, you had all the first time go perfect pass people. What was the term you used for them?
Done in one. So it's David Galler's award. Done in one. We get a big fat ring for it. It's like a Super Bowl Belichick ring. And yeah, done in one. And basically, it's one set of trays. Patients happy, thrilled at the end. You're in and out. And you've accomplished all their goals, and they're thrilled. And wow, you get to show those. And it's not just a happier patient, but from a business standpoint, you're actually profitable.
Way better.
Yeah. And that patient will then tell everyone, and you will have another dozen cases from that. And you will feel better about it because, when you see that patient's name in the schedule and they've now on their ace set of corrections and they're blaming you because why doesn't this tooth move? And they come in and their trays like crystal clean and they don't even have their trays with them. I mean, it's like, oh, yeah, you're wearing it? I wear it all the time, doc. Except right now, when I'm here with you, it was just, there was
I
a
happened to
solar
forget it this
eclipse.
morning on the way out of the
My
house.
dog ate it. Yeah,
Alien stole
yeah,
it.
yeah, yeah, yeah.
Yeah.
So you have to understand why cases fail in order to fix them. And most dentists don't have that perspective. Least reliable source is what your patient says in words. You look at actions.
Yes. I want to move on in a second to diamond makers and how that started and what your first experience was and how you came about that. But from my perception of what you're saying as not a clinical person, there's really two giant human failure points in cases not working out, not being managed. First is the patient not being compliant. Second is doc not understanding the real underlying problem when he's looking at the
You are
trays and the
correct. Yeah.
process. He's
Yeah.
not actually diagnosing the other
You
human
can't
failure.
fix a problem if you don't know what the problem is. If you go to patch it and you're just throwing mud on the wall and seeing what sticks. That's the phrasing. But whatever it is, it's to fix a problem, you have to understand the root cause. And if you can get to the root cause, then you can try different fixes on that root cause and evaluate the success of that. Most dentists are, oh, I heard we do this. I heard we do that. I don't even know why I have this problem, but someone told me to do something about it. And I think they say, I don't even know. I love this. I don't even know who told me. I'm like, hold on. So you're trying something that you don't even know where it came from. Like you thought it was important enough to remember it, but not who it came from. You got to know if it's important. You should know where it came from so you can evaluate it. Your evaluation process is kind of flawed.
Yeah, so there's really two human failures there, the clinician and the patient.
Yeah. But I'll tell you, let me comment because I believe from a whole separate standpoint, Align Invisalign is probably the greatest product ever invented in all time. In all time.
It's the only dental product that is a halo product that everyone knows the name of.
I'm going to go one step beyond. It's the only mass produced product that's fully customized. Only mass produced product that's fully. So this is like earth shattering. This is
Yeah,
like
that's
this.
interesting. I never thought about that.
Wait, it gets even one better. We 10x it at this point. It's the only mass produced product that's fully customized for a future point in time. Nothing even comes close to that.
Wow.
Right. But the greatest strength that it's removable is also its greatest weakness. It's
Yeah.
removable.
Yeah, you can't remove bracket wire. So, diamond makers, right? So, you went on this journey, you figured a lot of things out, you self-taught, you banged your head against the wall, trial and error.
Hard lessons.
And I think a lot of dentists start going down a hard path and they have one hard lesson and they just give up.
Or they stop doing one aspect. We teach them how to do IPR again, and then it's like, oh, I never want to do it because they got one or two patients yelling at them. Yeah, because you probably overloaded it. You gave them a first tray. You put on attachments. You did 6 or 7 areas of IPR. They're coming out. They're overwhelmed. I mean, that is not the way to manage a patient. We teach this. So why would you throw away the entire toolbox when you didn't know how to use the screwdriver? Learn how to use the screwdriver, and then it actually works. And this is where dentists just get lost and they get this bad taste. And so the number one dentist, the most common Invisalign dentists there is, do you know what they are?
No.
Dentists that don't do Invisalign anymore.
Oh,
There
yeah.
are like
I would have guessed that. That makes
36,000
sense. That's
of
so
them.
obvious.
Yeah,
Yeah.
they get so pissed off. They walk away. They're like, I'm never doing this again. I'm just going to keep sending it to the orthodontist, who, by the way, probably doesn't know how to do Invisalign any better than you did. And that's the reality for most orthodontists. I don't want to throw them all under the bus, most of them, but not all of them.
So, how is Diamond Makers born?
Ooh, yeah. So COVID. Uh, David
Oh,
said
it's a
yeah,
new
yeah, yeah.
organization then.
Yeah,
Relatively
well,
young.
David gave me a call and he said, I don't know, they're terrible. They're all shutting down. That's my David impression. You like it?
It's not really that close.
Not good, not good.
Not good.
And he says, he said, it's all shutting down. Can you do anything? And I'm like, oh, okay. And I'm paraphrasing, and I'm like, let me think about it because I don't like lecturing. I don't like getting up in front of people. It's not
I
a
think
talent I have.
I think it is a talent you have, you still have faith in. I think you could be a lot better at it. I think you're a lot better at it than you realize.
Yeah, if I wanted to be, I don't want to be. I don't want to get up in front of people. But thank you, Matt. Um, so I came up, I brainstormed, and I came up with a course. I think it's about 4.5 years ago. They eventually were named DCM Neo, which was the first course new, and goes back to a little matrix, red pill, blue pill, and so there were 20 of them. We just started out slow, and I kind of worked with it. And I had prior experience managing for David. I was president of the Empire, which is one of his original groups in the ACA. So I had this online WhatsApp vehicle, and I'm like, all right, I'm good at WhatsApp. Let's put it out over WhatsApp. People can't get together. So it is a mentorship course with a class that's constantly online over 6 months. And people are like, oh, I'm going to go on vacation. I'm like, oh, do you take your phone on vacation? Yeah, I do. I do. Oh, so just read. All you got to do is read. And once a day, you got to chime in. We require daily active participation because if you're just a voyeur, I don't want to know from you. You got to be engaged to learn. So, really, what I've learned after now 11 classes, I'm on the 11th class, 4.5 years later, over 400 dentists trained, literally making tens, if not hundreds of millions of dollars more between them all. And then over the course of their career, it's staggering how much money they make and how many more cases and how many more people they help. But what I've learned is we've packed it now with it's a daily experience online. There are 24 lessons over the course of 6 months, which bring you from A to Z, everything about Invisalign. Oh, doc, what do I do about corrections? Boom, it's in there. What do I do about starts? IPR. What do I do about storage? How do I fit all this into my schedule? I teach all of this, A to Z, anything you can think of in Invisalign is taught and retaught and improved. Oh, I like it doing this way. Great, do it that way, but at least hear me out. And then you're going to see why I do it. Maybe you're going to incorporate some pieces in. Most of the time, almost every class, you're getting these moments for people that I can see, literally feel online. Then we do marketing because you can't get in, and we should arrange a segment for you.
Cool. Yeah.
Yeah, we do marketing on Thursdays. I do case of the week on Wednesdays, where I show them an example, different example. Class three, going to an aesthetic class one. They're still skeletally class three. So I give these examples where we take teeth that are like this and we turn them around like this to the right way. And what? You can't do that with Invisalign? Whoa! You say you can't do something with Invisalign? I'm in search of how to prove that wrong. Okay. I can do
Oh,
almost
complex
anything.
complex cases. You can do a bracket wire.
Oh,
You
I love complex cases. You know why? Because most dentists have turned them down. Those patients come to you desperate in need of help. And I'm like, I can absolutely help you because I've actually done this dozens and dozens and dozens of times. No, everyone says you can't do it. I know what they're really saying is they can't do it. And so I've done stuff and I'm like, look, when I try something new, I'm like, look, hey, I don't know if this is gonna work. I don't know. I'm up front. I don't, but we're gonna give it a try. And but you've got to contribute. You've got to wear them all the time. And it works, and then I teach that. So I show them, and I show them daily stuff. I mean, this week we did average three cases. I did one lecture in Summit 4 years ago, I think. And I'm like, all right, I got to write a lecture. I'm sitting there at my desk. I finish probably in my regular GP schedule every day, maybe 5 to 8 cases a day, completions. And I'm like, all right, I'm just going to pick 3 cases from today. I'm going to write them up. We're going to do the math, show what the profit margins are, show how I did it, show the clean checks, show all the attachments. Everybody's into attachments, and show everything behind them. Three cases just out of one day, random pick. And here it is. That was my case of the week today that they're all fathoming over right now and asking me questions and then communicating within. So it becomes, and this is a great thing, it becomes a community that after the 6 months, the people from 4.5 years ago are still in that WhatsApp community that they interact in, that we see each other at ACA events. We see each other, they see each other at, I get pictures of people at like Ontario's dental meeting or Florida's meeting or whatever. They're like, oh, hugs. They've never seen each other in person, but they're giving hugs. It becomes a small family, and not just for Invisalign, but for dentistry, and it's great, and it's a an area that they can feel comfortable in. But so we do case of the week, we do marketing, we do. They have to report their numbers every Friday. I review ClinCheck. I field ClinCheck questions 1 day a week. We do on Sunday. We've now expanded to Sunday, and it's like very low key on the weekends, where we do motivational stuff.
I would love to do that with some of my stuff.
Yeah, I'd love to see that. That'd be great because people pick like self-help stuff. And I'm like, no, 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 no. I want to get up. I want to beat my chest afterwards. I want to feel like I want to get out of bed and run 1,000 miles. And I hate running now. But ultimately, that's motivation. And so we do that on Sunday, and that gets you going for, and that was another thing that, I learned that every weekend people would go home from COVID when we shut down, and I was still paying my people. They were coming in and they'd go home and watch the news. And I'm like, don't watch the news. Don't watch the news. They go home, they watch the news. World's coming to an end. World's coming to an end. Doc, I'm not coming in on Monday. I'm like, no, I'm going to still pay you. You don't really have to do anything. Just come in. We'll all hang. We'll whatever, make the office better. Yeah, I'm scared the world's going to end. Okay, all right, I get it. Come back when we're all back above ground. And so what I started doing was on Sunday, I started posting something motivational. And then I rotated it through. So I take that lesson and I carried it along because all on Monday when we got to go in, I mean, I'm there at 7 a.m. Oh my God, I'm waking up at 5:30. Dread what patient's going to come after me today. I mean, what team member's going to call out sick? What machine is not going to work? My computer's down. I mean, my God, small business is terrible. But I'm motivated because we do a Sunday motivation, and then they pass it to their staff because or team, because most dentists, then I teach them, take this WhatsApp format and put your team on it, and then have a better communication with them.
WhatsApp's a great communication tool. I use it all the time.
Yeah, so it's a full. In essence, what it's become is how to grow your practice to a diamond, but it's become so much more, which is how to grow your practice. And I don't bill it as that, but that inevitably, I mean, the average dentist coming out after 6 months will always tell me, on average, just 6 months, 150 to 250 more in collections just over the 6 months, not just the year, not the career, but just the 6 months they've collected more just by being in the class. And so there's some real profit, financial freedom. They've helped so many people. They feel more independent. They feel like they have a new lease on life. I get dentists who are newbies, just graduated, never done an Invisalign case. We teach them how. I get dentists who are 88 years old who come in and like, I don't know what this Invisalign stuff is. A scanner. I don't have one. Well, you'll get one. You'll probably get two.
You'll respect this at Energize. If you're doing Invisalign and you're doing impressions, we won't do Invisalign marketing for you.
Yeah, I don't blame you.
It's just
I have
it's not
five
good.
scanners.
It's not good
Can't
standard
live
of
without them.
patient. It's not good
Yeah,
standard of patient
yeah,
experience. There's a
yeah.
new standard of patient care today. It's called a
Yep,
scanner, and
yep.
the same thing with if you don't have a CBCT on site and you think you're going to send them somewhere else, we won't do implants either. And
Right,
we just
right,
the data shows both don't produce cases.
right,
If you're doing it,
right.
listen. If it's 2025, guys, if you're doing impressions, you're listening to this. Get if you want to do Invisalign, get serious and get with the times. Make an
Yeah,
investment. So one other thing, I want let's talk about real briefly is a lot of times organizations like this develop. Okay, so you're working with Galler, right? And then you're seeing like I could do some of this for a population also. And rather than Galler getting territorial and saying, "Whoa, whoa, whoa, I don't know if I want a competition called like we're the Invisalign guys, not DC. Like, I don't want this DCM thing around." You guys have the mentality of all tides raise all boats, right? So he starts saying, well, this guy's smart. I want him part of my organization. And then we can work together to improve the effectiveness for orthodontics amongst more people by working together. So one third of your people, I think you said, are AACA, two-thirds aren't, but then they join there. Two-thirds are, one third's not. And they join.
yeah. And David, I'm honored as well because David has recommended me DCM in his educational pathway. He recommends Reengage One, Reengage Two, then Diamond Club Makers as the pathway to achieve the most possible you can achieve out of Invisalign. So again, I'm honored to be a part of that, and then I'm honored to be a founding board member in the ACA when it first started under David. You know, he's as long as he'll have me, I'm honored to be a part of that.
Yeah, we're gonna wrap it up here in a second. Do you know my uncle Wesley Candair? He was a board member for a while. Wes Candair, maybe not. He, yeah, Wes.
Wes,
Yeah,
yeah, not
yeah,
Wesley, yeah,
yeah.
Wes,
Wes
yes,
Candair. Yeah,
yeah,
he's
yeah,
my uncle. He's a
yeah.
great
Okay,
sedation doc. That
okay,
so it's really funny. Years ago, I tried to get in the ACA, and my uncle was like, "Got to get it on your own. I'm not going to give it to you." And he's a board member who screens the vendors, and he'd call me after the vendor meeting, like, "Bro, you should be here. Cool, help me. You got to work for it. Get in there." And then
yeah,
years later, when we did the vendor meeting, I told that story that like. And he believes me. Like my uncle, I've grown my uncle's practice. He's an amazing guy. He's actually my wife's uncle. So, I want to wrap this up. Guys, everyone wants to do these things, but then not everyone's willing to do what it takes to do it. And sometimes what you need is you need a leader or a coach or a community to shove you down the road and make you jump off the cliff to do it right. And a lot of people have a mentality in dentistry. It's very scarcity mindset of I'm not going to pay X dollars for that because I don't think I'm going to gain from. Well, first of all, if you get into a community like this and you don't get what you need out of it, the key word is you because other people are being successful. If you don't embrace and do it, you suck. Sorry, it's Dental Unfiltered, doc. You're the failure, not the organization. Now, if you're a doc who's open minded that cares more about being successful than being right or being stubborn or being cheap, these organizations, I don't bring on coaches like this very often. It's only people I believe in. I've seen the results.
thank you.
If you're doing Invisalign, the American Academy of Clear Aligners or Diamond Makers or both, really both, the combinations like peanut butter and jelly are the best solution I have seen. And I see it across, I book 30,000 dental appointments a month. I share data with dental intelligence. I see a lot of stuff, bar none. the best choice you can make for orthodontics and Invisalign in your practice to develop a profit center that doesn't really hurt your capacity much, but creates a new place to find production and revenue. Dr. Wollock, thank you for being on the show. This is
Yeah.
something I've been looking forward to. Thank you so much for your time. I really enjoyed it.
Matt, you're the best. I actually really appreciate and always enjoy talking with you. It's been a couple of years now that we've known each other, and so yeah, it's always a blast. So thank you for having me.
Hey guys, if you're listeners, please like, subscribe, share. Me and Dr. Val and the other hosts on the channel, we don't make money off this. There's no pay to play, there's no sponsors. We do this purely for the benefit of the community to invest in you guys. So please, the best compliment you can give us is liking, subscribing, sharing, leave a comment. That means a lot to me, guys. Thank you guys and have a wonderful day.